So the question is, can you smoke cigarettes after a hair transplant? And if so, how long do you have to wait after a hair transplant to be able to smoke cigarettes again? I typically give two answers for this. You want the general recommendation or the recommendation of our clinic. And the reason I say this is because we've conducted a study that shows significantly reduced growth rates in heavy cigarette smokers post-hair transplant surgery. Now, the general recommendation is to quit smoking for about 7 days after your procedure. Now, this does make sense because you want immediate healing to happen, and you don't want the risk of infections or wounds not healing properly, so 7 days is the general recommendation. However, you also do want your hair that we've implanted to grow and to grow well. So for this reason, we recommend stopping smoking for at least 6 months after your hair transplant and for at least 2 weeks before your hair transplant. And if you refuse to do so, we actually get you to sign a waiver saying that you acknowledge that the growth of your hair might not be as good as it could have been. So smoking can affect your newly implanted grafts in a number of ways. The first way is that it lowers oxygenation to those newly implanted grafts and your tissues in general. And the reason for this is that carbon monoxide in cigarette smoke actually displaces oxygen from your hemoglobin, so from your red blood cells, which means that those cells just can't carry as much oxygen to the tissues. Without oxygen, we can't have good, fantastic healing. So that's the first way. So the second way smoking affects your newly implanted grafts is generalized vasoconstriction. When you smoke nicotine, it's a stimulant and your blood vessels will constrict due to a number of factors. That constriction reduces blood flow to the peripheries, especially the scalp. And because of this, you won't get enough nutrients, and again, you won't get enough oxygen to these newly implanted grafts that really need all the nutrition that they can get. The third way in which cigarette smoke harms your follicles is free radical and toxin damage. Now, you're taking in all these chemicals and they are surely going to have an impact on your newly implanted follicles. So at our practice, we actually really try not to operate on patients who smoke more than 15 cigarettes per day and refuse to cut down and or stop. Because we really have seen significant negative outcomes in heavy smokers.